Everyone experiences unhappiness and sadness occasionally. When the depressing feelings start to take over everyday life without a recent loss or trauma and cause physical and mental deterioration, they become what is known as depression. Each year in the United States, there is an estimated 17 million people affected with depression, costing $5 billion. The number has continued to increase over the past decades. The illness affects everyone in all parts of the world, but 1 in 4 women are more likely to experience severe depression with a 10 to 0% lifetime prevalence, compared to 5 to 10 for men. There are 2 main types of depression, one of them being major depressive disorder and dismissive disorder. Major depression disorder is a severe to moderate episode of depression lasting 2 or more weeks. People who have this disorder may have trouble sleeping, loss of interest in activities, experience a change in weight, have a hard time concentrating, feel worthless and hopeless. Dismissive disorder is an ongoing chronic depression that lasts 2 or more weeks, and in children cases lasting a year or more. They may experience a change in sleeping and eating patterns, low self-esteem, fatigue, trouble concentrating, and feelings of hopelessness. This mental disorder can dramatically impair a person's ability to function in social situations and at work. People with major depression often have feelings of despair, hopelessness, and worthlessness, as well as thoughts of committing suicide. Many only suffer from seasonal depression, also known as seasonal affective disorder, and mania depression, also known as bipolar. Depression is being seen more in children and teenagers. It strikes as many as 1% of children and 1.5% of teenagers in the United States today. The recent research published in Pediatrics examined psychological issues in thousands of children ranging from 4 to 15. The study found significant increases in emotional problems including depression and anxiety. Low-grade depression can begin during childhood or teenage years, while full-blown depression most often starts in middle adulthood. Within 5 years experiencing major depression, 0 to 40% of teenagers are most likely to develop bipolar disorder. Many times, depression is not triggered by a single factor. It is a combination of many things, such as genetic vulnerability, certain forms of stress, or changes in the brain. Experts are saying there is no single or combination of genes triggering bipolar or any other form of depression. It is believed that depression is caused by the imbalance of certain neurotransmitters, which are the chemicals that are transmitting messages between nerve cells. The latest research is now suggesting that it is also hereditary. The people with major depression and their immediate family are up to 3 times more vulnerable to have the disorder, but still the environment often triggers their disorder. Another factor in causing depression is external stress or significant life changes, such as death of a loved one, divorce, miscarriage, and losing a job. There are a variety of different ways of treating and curing depression. The 2 main ways of treating and curing depression are through psychotherapy and medication. Psychotherapy is aimed at helping this patient return to a normal lifestyle, or perhaps healthier and more satisfying. Medications are aimed to help balance the hormones and chemical imbalances that occur in the brain during depression. In addition to these treatments, there are also other ways of treating depression. Some of these treatments are psychological therapy and light therapy. And also, the number 1 is exercise. Teens and young adults with major depression are more likely to turn to alcohol or drugs to numb the feelings or pain. Oftentimes, they don't seek help and try to self-medicate until the depression totally consumes their lives. There are different types of medications that are used along with therapy that help someone overcome depression and successfully move on in their life. Most often, medication is the first choice for treating depression, especially if someone is experiencing severe depression or suicidal urges. The most popular antidepressant is serotonin inhibitors, which these benefit from taking these are not always immediately going to show. Most likely the medication is going to begin working and making a difference as quickly as 2 weeks. The main goal of the psychotherapy is to return patients to a normal, healthier life. It provides more positive ways of thinking and acting and also has a positive effect on the brain. The reason for using psychological therapy, patients are able to become more aware of their thinking patterns and how they originate. The therapist helps a patient identify thought patterns, emotions, and behavior that comes with them. It restrains the patient to recognize the thinking and react differently to it. When depressive thoughts crop up, make sure that you check out your mental and emotional energy. Are your thoughts, emotions, and actions leaning towards the negative? If so, it is essential to change these. It's helpful to think positive thoughts and speak in positive terms. You may want to envision positive outcomes in every area of your life. Listen to music that makes you feel good. Picture positive environments, a great trip or activity, or people who are positive and uplifting. You get the picture. Remember that all situations are temporary and they do have an end. This includes your feelings of depression, so keep your face to the sunshine.